Hi, David. How are you? Good to see you.
Hey, John, thanks for having me. I'm excited to be here. This is going to be an exciting time.
Yeah, I think so. And Happy New Year. It's the beginning of 2023, and today we're going to take a stock of a lot of things. But one of the things I know we're going to talk a bunch about is healthcare. So we're coming off of a pandemic, or at the trail end, or whatever we are right now. But when COVID became a thing in the U.S., it turned all aspects of healthcare upside down. Where do you think we are now, especially as it pertains to the cost and access of providing necessary healthcare to Americans?
Yeah, the gift that keeps giving. COVID is, and I think it just tells us that we are in that stage of it that it's going to be with us forever and ever. It's now like the common cold, the annual flu. It's just going to be that thing that will be persistent in our lives, and its virility, its ability to modify and become something else means that we're never going to get rid of it again. So, just from a public service announcement, go get vaccinated, take care of your body, take care of your health. You're helping other people, and you're really minimizing the impact that COVID or any of its variations are going to have on your own body and your family. And we've seen the tragic results of people who did get it and have had permanent damage, or they've lost their lives and they've left loved ones behind. So, I think this is something we still have to take seriously, but we're definitely through probably the hardest parts of it in terms of its impact to our society, our culture, our economy. But I do think there's some lasting impacts that we're still going to be dealing with. Now, I personally think we've had three COVIDs. We had that first one where everybody's like, oh, a couple of weeks, we'll be fine. That went well into a year. And then we had all the variations come out, Omicron, and then the next one and the next one. And that was COVID number two, where everyone was like, okay, we're hunkering down. We know what's going to be happening. And now we're in that third phase of just the everyday commonality of it. What's happened as a result, though, is that it has fundamentally changed our healthcare delivery system. COVID had so many impacts on hospitals and staffing that most hospitals found themselves understaffed. Now, we already knew this was going to happen. We knew that we had a nursing shortage. We knew that we had a primary care physician shortage. But when all of a sudden COVID was overlaid on top of that, those became far more acute than anything anyone was prepared for. Hospitals today, I have some interesting statistics that at least in Washington state, this past year, 2022, hospitals in Washington state lost more than 1.6 billion, that's with a B, 1.6 billion dollars in the first 9 months. Now the last quarter is expected to improve a tiny bit, but it's not going to put them in the black. Most of that was through travel nurses and immediate urgent staffing issues. More than a billion of it came from travel nurses. Now the challenge was that all the revenue they would normally get, hospitals would normally get through surgeries or elective care, none of that could happen, at least during that first COVID. So they lost all the revenue opportunities. Staffing, people said, I don't want to be here anymore. And then nursing unions said, well, if you want to keep us, you're going to increase our wages. Nurses hadn't had a wage increase in many years. And then physicians just retired. They said, we're done, we're out. And so all of these things came together to create a perfect storm. So during the second COVID, we finally have the ability to have elective care, but there's no beds to put anybody in because you can't move a COVID patient. They're in the bed. And people just ended up where they were, and hospitals couldn't even get their own members, their own network patients and subscribers into their beds where they could make money. They were taken care of out of network patients or patients that should have been moved off to a skilled nursing facility or other longer term care facility where it's more economical than it is at the hospital. And so they continue to be hit up and battered by the expenses of this. So we're now just starting to come out of this. But I think many states, and Washington's included, are going to be facing some tough economical issues when it comes to hospitals and healthcare systems and their ability to manage care well into 2023. Now, I will say a quick caveat. This isn't true across the country. There are some states that have been doing fine. The hospital systems are healthy and well, but particularly here in the Northwest, it's been hit pretty hard.
So, David, let's talk about your company, First Choice Health. First of all, for folks who aren't in the healthcare space, what is health benefits administration and your role in helping unwind this mess that you talked about and helping consumers, businesses, and hospitals, I assume they're part of the equation, all get what they need in order to thrive, and also your role?
Yeah. First off, I'm the Chief Revenue Officer for First Choice Health. And what that means is that my job is to go out there and tell people our story and get them excited about the possibilities and then bring them on as a customer, service them, and get them to renew, the normal cycle of growing a business. The business we're in is helping self-funded companies deploy a healthcare investment into their strategy and for their employees. So self-funded means your company perhaps might get your insurance through a Primera or a Regence or a United. Those are traditional commercial insurance companies. And their job is to provide a network of physicians and hospitals and care team that you can go to, and you pay your premiums directly to them. And let me just say, I think we have a better mousetrap. What we're saying is you as a company could take your own agency back in and say, we're going to retain our healthcare dollars rather than give them to one of those other companies. We're going to keep that and manage it ourselves. But let's be clear, no one's good at doing their own laundry in this regard, so we do it for them. We administer and set up a health plan that you, as your self-funded company, pay for directly. We take a fee, and it's just an administration fee, but what you're not doing is paying for the profit margins and all of the other things that a commercial plan would be doing. So you own your data, you own your plan design, you own your strategy, you own your healthcare investment, and we are just administering that for you. Now, this used to be something that only the big Fortune 50, 100, 500 companies could afford to do, and you had to have thousands of employees for it to make sense. Well, today, a company the size of 150 to 200, that's usually the low end of the threshold, can do this themselves. They can self-fund their healthcare investment and hire a TPA, a third-party administrator, to just run the business. That's the call center, the 1-800, I have a question. That's contracting the network. That's paying the claims and letting the members know that their claim has been paid or they have a copay or things like that. And then reporting back to the employer all the information that they need in order to make a strategic decision about their ongoing healthcare investment. So that's what we get to do. We primarily work with hospitals and health systems around the country. And then in those areas that the hospitals and health systems serve, the communities, we get the local businesses who are large enough and want to do this to be a part of that. And so we create a nice little pocket of care within the communities around the United States.
And it sounds like it benefits the community by being community oriented. I wonder, I was trying to think as you were describing this, the difference between, Amazon or whatever that might have its own health care and a smaller company. It probably it's a risk thing, right? Meaning, if someone at Amazon gets really, really sick, it's sort of absorbed. I'm not maybe using the right words, but sort of absorbed by the fact that they have a large employee population. How are the dynamics different in a smaller company, and how do you address that sort of thing?
You bet. Well, it's no different than what the insurance company is doing for you when you go out to the commercial insurance. They're absorbing the risk that something terrible is going to happen, and they're also absorbing the opportunity that nothing could happen. So insurance is just, in the simplest of terms, 50% of the people are paying for the other 50% of the people. That really is what insurance is about, unless there's a catastrophe and everybody's, gets hit, and then the insurance carrier takes a hit on that. But what happens is there's a thing called stop loss, employer medical stop loss, which protects the company. They're basically buying another layer of insurance, saying, here's what we think our spend is supposed to be. We've done the underwriting, we've done the evaluation, and we think the spend should be here. And if we come under that, well, then we have savings for the year. If we go over that, especially on catastrophic claims, somebody gets cancer, somebody needs a bone marrow transplant, somebody has a car accident and needs long care or brain surgery, whatever it might be, you have insurance that sits on top of that stop loss insurance. And that stop loss carrier covers those unexpected high claim costs for you. And there's lots of different ways to organize it. There's lots of different ways to set it up. But basically, you're saying, I'm able to spend this much money this year on our healthcare, and I'm buying insurance in case I go over. But I'm going to hope that I have a good TPA to work with to help me manage my costs and my claims and my employees to keep that as low as possible.
Oh, that's really interesting. And also, there's probably another dynamic where, because the large commercial insurance companies may be asking, for like employee health programs like smoking cessation and those sorts of things. And if a company's working with you, they get to sort of pocket the savings of folks being healthier. So there's like there's even more of an incentive for a business to do the right thing vis-a-vis its employees.
Absolutely. The thing that we're finding is that, and I just saw some recent studies come out, that health plan design, the benefits you offer your employees, is probably more of a factor than the salary or someone's pay in deciding if an employee will stay with your company or leave your company.
Interesting.
So here's an opportunity for you to look at inclusivity in your healthcare plan design. Look at, because you own it. It's all you. You're not being told by a commercial insurance carrier what your plan will look like. You get to design it specifically for your population. So maybe you want to have a bigger maternity program. Maybe you want to add something about smoking cessation, maternity management, weight management, all these different programs. You can put those in place. And then for a few dollars here or a few dollars there, you can build out a program that is specifically designed for your population. There are some companies that are very inclusive and want to make sure they have something for everybody, every minority, every special interest group, or whatever it might be, however you want to call them. Everyone's taken care of. And others want a more thin plan design because they want you to go take care of those things yourself. Either way, it's your strategy as an employer, your dollars you're spending, your investment, so it's your decision.
Interesting. So it sounds like your business, in some respect, is you're operating a marketplace, meaning more businesses work with you. You have the opportunity to work with more like hospital networks in your area, and vice versa. And so that reminds me of advertising marketplaces where I've spent parts of my career. Do you agree there's sort of an analogy there? And then what are some of the dynamics that makes your marketing efforts most successful in that type of marketplace?
Well, I think there's a lot of similarities, and certainly over the years we've seen a huge blending of boundaries and a thinning of any borders that might exist between industries, marketplaces, private industries, and so forth. So what I would say to this is it's still marketing 101. It is still about differentiation. It's still about positioning. It's still about that brand promise. I understand, I used to teach marketing at one of our local universities, and I always put up two definitions of branding. One is a name, a term, a sign, a symbol, differentiating your goods from somebody else's. And we talked about the original brands. By the way, it was Nabisco. It was the National Biscuit Company branded on the barrels coming off the ships. Or we can talk about brands in terms of a promise held in the mind of a consumer, of an individualized experience from a product, a person, or an organization. Now that promise has to be differentiated, so it's not the same promise anyone else is doing. It's not vanilla. It's not mediocre. It has to be differentiated. You have to talk about your value proposition. I mean, this is what I'm doing all day, every day, is trying to separate out what we offer compared to the competition. And that competition is varied. Some are big, giant Goliaths out there, and some are smaller. Some are new entrants based on technology, and some are traditional legacy-based companies. My favorite quote came from Jerry Garcia of the Grateful Dead. And he said, you don't want to be considered the best at what you do. You want to be considered the only one doing what you're doing. So there's no need for a whole lot of TPAs out there, third-party administrators. But there is a compelling need for what we can only do for you. And so that's where we spend a lot of our time trying to find that extra value proposition that separates us from the myriad of other options out there and then delivering on that promise. I will only add one other element here is that it's also still about relationships and engagement. And so much of our advertising today is disconnected, it's passive. I think we spend way too much time on email marketing, trying to, through email, hey, would you like to? I get so many of those a day. And it's like nobody bothered to find out about my company, find out about me, understand what my issues are. My favorite thing is I get an email from somebody who said, I'd love to discover more about your company. But in the first line it said, we have the perfect product for you. Well, then you should already know about my company, right? So we need to do our homework and understand the people who are making the decisions in the business. And I think we've lost sight of some of that in our marketing.
Oh, I totally agree with that. And I was not expecting that quote, the Jerry Garcia quote. I don't think I'd heard it before. It just made me think about this past weekend. So I rented a car, and the car had Sirius XM, which I don't own, but I don't have it regularly, and so I was flipping through the channels, and I actually listened to the Grateful Dead channel. I don't consider myself a Deadhead, but it's so soothing. It definitely is unique compared to all the other channels.
There you go.
Well, I digress. So, when we were prepping for this, and I was talking about some of the topics that were really interesting to me, I want to rewind a little bit. Not everyone can say that they were trained by Stephen Covey. And so, for folks that don't know who he is, talk about Stephen's work and then also your involvement with him.
Yeah, I've been very fortunate to have been able to sit at his feet and learn from him directly. Dr. Stephen Covey is very prolific in his writings. His most famous book was The 7 Habits of Highly Effective People. It was one of the top-selling business books of the late 1980, 90, 2000s. And he's written several companion books with his co-authors on purpose and other habits and leadership. He was the founder of the Covey Leadership Institute, which then ultimately joined with Franklin, which was a daytimer planning company. So that became Franklin Covey. And I was a complete nerd about all this stuff. I loved it. I got to sit at several seminars, have meals with him, and got trained in the 7 habits. So I am a certified facilitator in the 7 habits of highly effective people. Now, if you haven't read the book, there's lots of shorter synopses out there on the internet you can find, and lots of information about the 7 habits themselves. But core in there is this belief that we can manage time or we can manage our lives. Time is a finite amount. We don't get any more or any less. And the idea that we can manage it to get more out of it, that's a lie that we tell ourselves, and that we can somehow make more out of a very discrete, finite period of commodity that we have. Rather, Covey would say, rather than being driven by the clock, be driven by a compass. And the compass points you always in the direction you want to go. And he would refer to it as your true north principles, the things that are most important to you. And he would then translate that down into a personal mission statement. I wrote my personal mission statement 28 years ago. It is still valid today. I still look at it, if not every day, at least a couple of times a week, to refocus myself and make sure, am I leading my life, not just living it? And what we ask in this process is also, and this is one of my favorite things out of it. And sometimes people say, how have you accomplished so much? Or wow, you get a lot done in your life. And I say, it's because I ask the same question every week. The first thing I do is I identify key roles or relationships. And you can think about like the type of hat you wear. Now, I have the hat of a father. I have the hat of a spouse. I have the hat of a child, a brother, a son, a community member, a volunteer, an employee, whatever the role is, that hat that you wear. And then I ask myself, for each role, what is one thing I can do this week to make a significant and positive impact in this role or this relationship? Now think about that for just a moment. It's a baby step. What's one thing I can do this week? And I'm not going to be able to do all of the roles, all of the hats, all of the things every week. But let's say of the 5 that I have, maybe I pick 2. And I ask myself that question: what's one thing I can do this week to make a significant and positive impact in that relationship, in that role? And then you actually put that in your calendar. You schedule that. So yeah, maybe it's a date night. Maybe it's quiet time with a loved one. Maybe yourself, you have a relationship to yourself. So it's some quiet time or exercise or journaling or meditation or a concert or a walk. Maybe it's phone calls. Maybe it's writing letters. Maybe it's whatever it could be. But you schedule that every week, the thing that you can do to make a significant and positive impact in that relationship. And then what happens over 52 weeks, a year, you've taken 52 baby steps in a relationship. Now, if that's not impactful, I don't know what is. And then if you keep repeating that year after year after year, you get momentum in a life that you're leading rather than just letting life happen to you. So a personal mission statement just helps you to focus. What's going to be most important? What are my true north principles that are going to drive and guide me? And boy, sometimes those are hard. And then what are the roles that I have? What are the things I'm going to do to make an impact in those roles? And then I plan weekly. And then, of course, I spend a lot of time journaling to go, how well did I do? Did I fall down this week? Was I really on task? Because I'm not going to beat myself up. I am not perfect. I am still a work in progress. But if I look back, I can learn lessons that will help me if I'm truly interested in improving myself over time. So for me, this has been a huge investment of time, energy, but the output has been phenomenal, and I would not have traded it for anything.
Well, when you describe a series of baby steps, to me, it seems very achievable, as opposed to some of the traps that I've gotten in your work at the beginning of January, and you fall into the trap of a New Year's resolution, some life-altering thing. I'm never going to have anything but raw food again in my life, or whatever it is, and you're setting yourself up for failure. At least I have when I try to do those things, because I'm not kind of aligning it with a mission or compass. I like that term. And then taking incremental steps. That's really cool. It sounds like that experience really set you off to a great course. And you've mentioned inclusivity several times now throughout our conversation in different ways. And I know that's very important to you. And I can see, looking at you, like me, you're a white male. Can you talk a little bit about your personal perspective on the topic, why it's so important to you? And then, not only are we a spouse, a father, a child, etc., we're also leaders in our organizations. And so how do you think about that in perspective to what you can do to improve things at First Choice?
Yeah, this is really a passion play, an area of mine in 2 regards. One, I am a white male, and I have to recognize my experience and perspective is extremely limited and informed by my privilege, whether I am aware of it or not. And so the first thing I've had to remember to do is to do my own homework. It is not anybody else's responsibility to teach me about their minority experience. I can read their books. I can listen to their podcasts. I can attend their lectures. I can watch their movies. I can immerse myself. And then I can find a friend or somebody who is willing to help clarify. But it is not somebody's responsibility to come in and teach me as a white male why I'm privileged and why I may live in why I do live in a racist society. So the reason why this is important to me also is because of several factors. One, I have a white male son. I have a white female daughter. My partner is an African-American male. And I have to be aware of all of these dynamics because I want my son to grow up in an environment that is very different than the one I grew up in, and with a paradigm and mindset that's different, because that's where change is going to happen. I want to look at the world in which my daughter is living and the structures that are designed to keep her down and keep her voice muted and suppress her amazingness and fight against that. I need to look at the dynamics between me and my partner and the environment that we live in and spaces that it's safe for us to be in or not safe to be in. And particularly from his perspective, the environment and society that he has to deal with on an everyday basis that I never even have to think about. So for me, just being aware of these things has been eye-opening. And I'll tell you what, I still get it wrong. I still get it wrong all the time. Luckily, I have people in my life I can ask clarifying questions, or when that happened, what was the dynamic, and so forth. The other principle, other than doing my own homework, is second, making sure that I don't do the white male repeat, which means in a meeting, whether a female, and this happens more often than with females, a female in the meeting will say, I have an idea, a recommendation. And what typically happens is that people go, mm-hmm. And then a white male repeats it and and people go, oh, that's a great idea. Don't do the white male repeat. Just take a moment and say, Susan, Barbara, Tracy, whatever that person's name is, I'd like to hear that again. Would you please repeat that? Amplify the voices and the origin in which they came from. Do not take it on as a white male to repeat a minority or some other disadvantaged person's idea. Amplify their origin, their idea, and that voice itself. Make space for it. That's the power I have, is to make space for something, to shine a light on something. And so that's what I'm spending a lot of my time doing right now. But I do think that a lot of our diversity gets lost when we don't create the space for that. And so for me at First Choice Health, I'm spending a lot of time just trying to make sure I'm creating opportunities for diversity to come up naturally, or create structures that keep diversity from happening, and create ways to break that down. It's not enough, and this I'll stop here, but it's not enough for me as a white male to say I support. It has to be that I'm actively fighting against the things that keep our minority and disadvantaged voices suppressed. It's not enough for me to say I'm not racist, or Black Lives Matter, or I'm here for trans youth. I actually have to be fighting against the things that are suppressing, diminishing, or taking away those voices and the equity and rights and privileges that they should be having. So this is where I think a lot of white people get struggling with. It's like, I'm not a racist. And the disadvantaged voices are going to say, well, unless you're actually doing something against the privilege you have, to take that away, to destructure it, to desystematize it, you're actually enjoying it, which continues to foster the environment we all live in. So for me, it is amplifying the origin and the voice that it came from, and actively working to dismantle the system and the organizations and structures that just naturally give me privilege.
David, I'm smiling. There's so many great things that you said there. I think when I try to think about when I'm at my best, or when I can be at my best, it's what you were saying about admitting that you're wrong, and being able to admit that you're wrong, and being able to be wrong sometimes. And I know that for me, when I'm not at my best, I'm maybe afraid to put myself out there or allow others to be heard, because I'm worried about being wrong.
Yeah.
And so I think that's so important. And then something that I think was underlying in your message is that when everyone's ideas are brought to the forefront, your business improves. And so, like I think hopefully we're all having recognition that that everything that you're talking about and doing it, there's no downside.
Yeah.
So
There's no downside
there's
whatsoever.
no downside.
The creativity, the diversity, the perspective, the growth that happens when we are inclusive of different experiences and perspectives and paradigms is always, always beneficial. The people that go, oh, that's bad, are the people who are having to let go of power. And it's power that people hold on to that continues to keep these structures in place that disadvantage others. If we can let go of that power, there is so much more bounty on the other side of that equation.
So let me end here, and I'm gonna shift gears a little bit. So someone's been listening to this. They're inspired. They want to write their mission statement. They heard about the Grateful Dead. They're in a soothing mood. I know that you and I are both in. We're both into wine. We're both into champagne. I think you more than me. So I'd like you to give everyone who's listening, as a bonus at the end for this, either a wine or a champagne recommendation that costs under $50 for the bottle, and why you chose it.
Well, I have both because I couldn't pick
Okay.
just wine or champagne. And John, you're killing me. I just came back from Napa from New Year's, where I spent a week, several days drinking glorious champagne and drinking some fantastic wine. Right now, I am really enjoying sparkling wine. In the United States, if it's produced, it's called sparkling wine. Champagne is only produced in Champagne, France, but we use it ubiquitously. But sparkling wine, my favorites right now are from J Vineyards. They are located in the Napa Sonoma area, and they have a variety of rosé and white wines. My favorite is a Blanc de Blanc, which is a Chardonnay grape that's made into this amazing, delicious, cold, crisp, gets you right in the back of the mouth feel. Champagne, cannot drink enough of it, even though I have tried. My second favorite right now is also a Washington State wine, a red wine out of Betts, B-E-T-Z, Betts Winery. They are top of my list right now, and they've got two wines that are really just wonderful. They're French, and I'm going to mess up the name. I'm not even going to try with them, but Betts has some really nice Cabernets that I would strongly recommend people try. But here's my one thing about wine. Don't go with the ratings. Don't worry about if they got a 92 or a 98 or an 87. Try it. Drink something other than what you're familiar with. Taste it. And if you like it, drink more of it. And if you don't like it, don't drink any more of that. Everybody's wine preferences are different. We drink from our history and experience. So if you enjoy something, put more of that in your mouth. And if you don't drink it. It's that simple. But I do think you can get a lot of amazing wines at $25 or less. You do not need to be spending a whole lot of money on wines. My secret is I go to Costco. They have some fantastic deals on wines. So I suggest Betts and J Vineyards for your champagne and red wine experience.
And Costco works with local producers too, so
They really
you're
do.
not just getting the big stuff.
Yeah.
And one more tip. This one's for me is take notes too, because sometimes you can't always remember what you felt the next day.
100%. I have a journal I take notes with. And well, here's the tip off of that. When the wine pourer, the tasting person sees you taking notes, you often get to try more things because they see that you're serious about this, and they start to bring things out and they want to know what you're writing down and having a good time with it. So absolutely take notes.
Oh, that is a really good hack. Okay. All right. Thanks, David.
You
Appreciate it.
bet.
Thanks so much for being here.
You bet. Thank you.